Hi everyone. Welcome to week 2 of HSAM 3150. For those of you that don't know me, although I think everyone does, I am Dr. Jillian Harrington. I'm your instructor for this term. And just want to talk a little bit about, for those of you that have had my classes in the past online, you probably know that each week I do just a brief summary and review quiz questions that were included in the prior week, but we didn't have a quiz last week, so I don't have those to answer. But I do want to just talk a little bit about data analytics and why it's important for us to take a look at this topic in the depth that we do. So last week we talked generally about analytics. How might we use analytics in the healthcare setting? What type of information is out there that we can use to compare ourselves to from an analytics standpoint. So if you haven't already noticed, I would hope by now you have, but the way this class is set up, I'll detail your readings that you need to do here, but they did place them in a separate folder when they created this class, so you always have to click on this folder to find your videos or resources, those types of things. But then you can click and it'll take you right back to where you were. You'll always find your discussions, written assignments, etc. right here in the classroom. And the assignments vary class or week to week as to you'll always have a discussion of some sort, but otherwise it'll kind of vary week to week. So last week we looked about the transformational aspects of data analytics. So you did that in your written paper, and then we also took a little bit of time to look at some of the data that's available out there that we can use to compare ourselves to. So this week what we're going to be focused on is a few different areas actually. We're going to talk about the use of data in quality improvement. So one of the ways that we can really use data overall to impact our organizations is to take that data and use it to improve ourselves. So where are we, not just saying, oh, well, I really, as I walk up and down the halls of my hospital, it doesn't seem like nurses are washing their hands enough, or it doesn't seem like the floors are getting cleaned enough by the housekeeping staff, or I'm not sure that everyone's getting the food that they're supposed to be getting. Just those gut feelings or general observations are not really enough to truly create the detailed quality improvement that we need to do on our organizations to provide good quality care to our patients, to lower costs, and to provide that good bedside experience to patients as well. So we want their outcomes to be good, we want their experience to be good, and we want it to be cheap. That's pretty much what we're going for nowadays. So how can we use data to do that? And so we'll go with the first option. The nurses and other providers, maybe we notice that there's an increase in infections, and our gut tells us that maybe they're not washing their hands as much as they should. Well, maybe we need to track that. Maybe let's check it out. Are there sinks in all the rooms for nurses to wash or doctors to wash their hands, or therapists? Are there dispensers for hand sanitizer? Are there issues with gloves? Maybe people have latex allergy, but there's not non-latex gloves available for them. Like actually checking out the hard data on these things instead of just going with a gut feeling. Oh well, I think that most people do this, or most people think this way. Having that hard data is important. We're also going to talk about big data. So when we talk about big data in the healthcare industry, I'm just going to pop open this article quickly. This is one of your articles that you have to read. But when we talk about big data, we're really talking about that all of that data that we have in our organization, and some of it's very structured, such as like a electronic health record, or maybe data flowing into our decision support systems, maybe our financial data, those types of things. But then also we have kind of unstructured data that flows around that is maybe for projects like a quality improvement project, or all of this other just random data that we collect on our organizations. How can we harness the energy of that big data. Take that data and compare it to data that's out there from other organizations, from the country as a whole. How can we use big data? And then it kind of takes the next step, and we're going to spend some more time on this in the weeks to come, but takes the next step of big data from a global standpoint, helping to drive healthcare decisions. So precision medicine initiatives where you have your genome mapped. They have all of your social determinants that play into healthcare. The healthcare industry has all of that information about you, and it can help them to better tailor the care. Instead of just throwing drugs or throwing treatments at patients, it can really tailor the types of treatments or drugs or well care that they receive based on their own individualized data. So having that big data world, and then kind of being able to pare it down to make it a patient-focused data initiative. So there's a big push. There's a study that's called All of Us right now that the NIH is piloting, and I know Duquesne has a section of the All of Us. Pitt has a section of the All of Us grant, and they're collecting data on literally all of us, but they're not going to get all of us. But they're looking to collect genetic data and other background health information on over 1 million people to be able to kind of create this database that will help to describe all of us. So they're not going to get quite all of us, but they're really looking to get a pretty diverse sample to help to drive some of these innovations. And then maybe eventually everyone will be mapped, and it would be just a giant database of all of our information. From the positive care aspects to that, I think that sounds awesome. From the privacy and security aspects and how everyone will know everything about us that works in that data, that's kind of scary. So there's a little bit of good and bad in that. We're also going to talk this week a little bit about data governance. So think about data overall, like that big data set. We need to know how to govern that data. We need to make sure it's protected. We need to have the tools to use it effectively, all of those types of things. So that's where we'll see data governance come up. So we have 2 assignments this week plus our feedback here, this Edpuzzle. We have a discussion that talks about data-related projects, and there's kind of an old adage called garbage in, garbage out, meaning that everyone, and we see this all the time in healthcare or in online classes, people blame the technology. Oh, the technology didn't work. Well, more often than not, it's not the problem of the technology, it's a user error. And that's what we really see, having taught online for 15 years. I'm going to say 99 times out of 100, when a student or a fellow faculty member is having an issue with the technology, it's a user error in some way. Maybe you haven't been trained properly, maybe you have never seen that aspect, or maybe you're just not following directions. That's almost always what happens. So it's that garbage in, garbage out. When we're talking about data, if you're feeding bad data into the system, the product coming out is going to be bad as well. We see that a lot in academia. I will talk with a colleague, and that, like, I'll say, I'm really having trouble getting students engaged on this particular thing. And I'll hear from my colleagues, oh, well, I hear from my students that they really like this. But then when we dig into it a little bit further, 1 or 2 vocal students said they really liked it, when that's far from a majority. So it's really hard to, if you have garbage going in, if you just have a couple vocal people that are saying that nurses aren't washing their hands, when maybe in fact it's the physician's problem, that's that garbage that's going in, and therefore the decisions being made are going to be garbage coming out. So how can poor data impact things like big data projects? How do you improve the quality of data, etc.? So that's our discussion for this week. Our paper for this week is, you can write it in a memo format, and if you've written memos before, great. We don't use memorandum as much as we used to back in the day, so you can certainly write it as a white paper, and a white paper is written just like an essay. But about the need for a data governance structure in your organization, and then talk about what types of structure you'd recommend based on your readings for this week. So you can do that, just 2 to 3 pages, double spaced. If you have used references, make sure that you cite them appropriately in APA format. But a memo, white paper, either way, and this will give you a good opportunity to do what we have to do in the healthcare administrative sector. So, as the compliance officer, I was often called upon to write white papers or memos to increase the knowledge of those that were above me. So, the CEO, the COO, the CNO, sharing information about law and regulations, et cetera, that govern. Since we're talking data, that govern data security, use of information, et cetera. So oftentimes especially in middle management roles or even in higher man, I was the chief compliance officer, but that was my area of expertise. So I was expected to put together documentation to share with my colleagues on the senior staff. So you will be expected to do that as a manager, and this is a good opportunity for you to practice that. We still, even here at RMU, we write, we put together documents and write white papers to share information with the provost, with the president, etc. So it's not something that's just simply in the healthcare administration sector. Being able to write a good white paper is a good skill to have overall. So that's all I have for this week. If you have any questions, please feel free to reach out. I look forward to interacting with everyone in the discussions this week. This past week was a little bit crazy with the start of classes, and I'm running 3 classes right now, so it got a little bit crazy, but I look forward to working with everyone in the discussion, and hopefully you all had a good Labor Day holiday, and we'll talk to everyone again soon.